Closed captioning for Education Matters is sponsored by Margaret's Garden Adult Daycare and Will Lou Gray Opportunity School out of West Columbia.
Body language can tell you all sorts of things. Like someone is having a stroke. Know the sudden signs. Learn fast. Face drooping, arm weakness, speech difficulty. Time to call 911 and get them to a hospital immediately. Learn the body language and spot a stroke fast.
Today inside of Education Matters, we're talking about life-saving information. Education Matters is next. Good morning and welcome inside of Education Matters. My name is Donna Moore Westby, your host of Education Matters, where learning is living. Thanks so much for watching on this beautiful Sunday morning. We're excited today because May is National Stroke Awareness Month, and we have some guests in the studio today who will shed some light on some great information that I do believe will help to save a life. But of course, we'd like to acknowledge the sponsors of Education Matters. We do this every week because they help to make it possible for Education Matters to be on the air and to support the Education Matters mission. Starting with our corporate sponsors, the University of South Carolina in Aiken, Margaret's Garden Adult Daycare. They are now open, just recently celebrated their grand opening. Gorgeous facility. I got the chance to stop by and walk through. I tell you, it's like a clubhouse, truly. And we encourage you to go by and check out Margaret's Garden. Also, Westby's Products and Services, creator of Dawn Seasoning Delight, all-purpose seasoning and marinade. Will Lou Gray Opportunity School out of West Columbia, South Carolina's premier alternative education school for children in South Carolina ages 16 to 19. Security Federal Bank. There is a Security Federal Bank near you. Also, Howell Printing, and they are out of Aiken, South Carolina, your full service printer, also offering graphic design services. And then Access Chiropractic, where the chiropractor is Dr. Blair Bradley. Thanks so much to all of our corporate sponsors, and of course, recognizing WRDW for allowing us to be right here on the air every Sunday morning from 8 to 9 a.m. Then also recognizing our individuals. I call them our friends of Education Matters. They've pledged just a little bit of money for as often as they want to. Inside of Education Matters, Bill and Joy Bradley, Sharon White, Isaac and Betty Rucker, and Henry and Nancy Craig. If you're interested in becoming a part of our sponsorship family, you'll get those details throughout today's broadcast. Okay, moving on to this week's chalkboard reminder. I've already kind of touched on it a little bit, and here it is. May is Stroke Awareness Month. Yes, it is. Pay attention to your body language. Your body tells us different signs and different messages every day. Are you paying attention? Know your risks for stroke and take steps to remove those risk factors. If you don't know what those risk factors are, guess what? We're talking about that today, and we also encourage you to get a checkup, all right? Doctors are there for a reason. Make sure you use them. That is your chalkboard reminder for this week. All right, quickly moving on now to the Education Matters Word of the Week. That is what that sound means. Every week inside of the broadcast, we do provide you with a brand new Word of the Week so that we may all, no matter what age you are, continue to learn and grow. And here is this week's word: pestilence. Pestilence, all right? Pestilence is a noun, and it means any usually fatal epidemic disease. It also means a pernicious evil influence or agent, okay? And here is this week's sentence. The country was in crisis when it was plagued by both pestilence and floods at the same time. Some of you know that word from the Bible. Israelites were met with quite tremendous pestilence. You know the stories. Well, anyway, that is this week's Word of the Week. Now for a continuous list of the Education Matters Words of the Week. By now, I hope you know what to do. Just go to that website, www.edmat.com, okay? We're making some updates and changes. Stay tuned. John Gray here from WRDW is working on some really exciting things, and also shouts out to our website designer, Brother Karis Johnson. He actually does this as a donation, a contribution to Education Matters, and we thank him for that. So make sure you check out our website from time to time. We're always making updates and changes, and also feel free to write me. Here is my personal email address. No one checks those emails but me. And that email address is donnawesby@aol.com. Did you already run it, Lauren? donnawesby@aol.com. Now, it takes me a moment from time to time to get back with you, but I certainly will. All right? I want to move on to let you know what I participated in this past weekend. Grammar lesson we'll pick back up on hopefully next week. So I'm going to give you a little break. I know the children are in testing or they're preparing for testing. But this week I wanted to talk to you about an event I participated in on last week called Run United. As I'm talking about it, I'm going to show you a few photos. Thanks for your help, Lauren and John. Run United was a fantastic event organized by Aiken Electric Co-op on this past weekend. It involved 3 events, a marathon, a half marathon, 13.1 miles, a 5K, which was 3.2 miles, of which I participated in, and also a kids fun run. Now, when I originally signed up for this event, shouts out to Kiata Priester from Aiken Electric Co-op who organized it. You know, I was excited about getting involved in something that was going to benefit the United Way of Aiken County. That was my first mind. But as the race got closer and that morning, it started to really hit me how important this event was and what it could mean to me and my personal goals. And as I participated in the event, you know, I'm not a runner, I'm a walker, I'm a power walker now. I'm a mean power walker, and I'm excited to say that I actually finished with a power walk in 45 minutes and 39 seconds. So here's the video of me crossing the finish line with some help from USC Aiken Pacers cheerleaders. I was surprised. And there I'm doing my victory dance. Of course, you gotta have a victory dance. Good job. But I wanted to share with you, as I was walking, I had an epiphany, okay? And for those who've paid attention to our words of the week, you know what an epiphany is. I had an awakening. The Lord kind of spoke to me. And this race was more than about a race. It was really about life. It was about finishing what I started. Along the race, there were those who took off ahead of me, and they, of course, made it to the finish line quicker than I. But then there were those who started off a little fast, and then they slowed down. But I kept the same pace, and it was a very good pace. And eventually, I even was able to pass some of those who started out ahead of me. And along the way, the message came clearly to me. It's not about how fast you take the race, but it's that you finish. And that was a great message I want to pass on to you in life. And believe you me, when it's time for you to finish that race, whether it's a traditional finish or something a little bit different, the Lord will let you know. All right? So I'm excited about that, and hopefully you've been able to, you'll take a message. The race is not given to the swift, but to those who endure to the end. You're inside of Education Matters. We'll be back.
I guess sometimes things just happen. Devastating things. It's got nothing to do with fairness. Bam, your whole world changes in an instant. And you never see it coming. That's what happened to me the day my mother had a stroke. I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Protect the ones you love. Spot a stroke. F-A-S-T. Fast.
Hey, Hard, what's this?
That's my resignation letter.
You're resigning.
Why? Because you're constantly ignoring me. You're half as active as you used to be, and you eat stuff like this. You've been putting me under a lot of pressure lately. That's why I'm ready to quit.
I forgot. I'll do better. Please, don't quit on me.
Okay, but remember, it's not what you say, it's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Welcome back inside of the broadcast. You're watching Education Matters with me, Donna Moore Wesby, where learning is living. Today, learning will certainly be living. We're talking about stroke awareness. Listen, it doesn't matter if you are an adult or if you are a child. The information we will be sharing in today's broadcast could certainly save a life. So we encourage you to watch the entire hour today. Joining me in the studio are two representatives from Aiken Regional Medical Centers who will help us in this dialogue. And I'm very excited to have them as new guests on the broadcast. Dr. Gregory Sengstock, who is a neurologist at Aiken Regional. Welcome inside of the broadcast.
Thank you.
All right. And beside you is Miss Rosalita Kirkland, a registered nurse and also stroke coordinator at Aiken Regional. Welcome to both of you again. We're excited to have you. Now, I did just a little bit of research because, you know, I wanted to make sure that I kind of was a little familiar with what we were going to discuss today, and we'll share some statistics, of course, throughout today's broadcast. But I understand that May is Stroke Awareness Month. Dr. Sengstock, why was it even necessary, do you believe, for us to bring such awareness to this particular topic in our country?
Well, it's been going on now for probably more than 10 years. Stroke has been the third leading cause of death in this country for many years. Through awareness and through some treatment options, stroke has now fallen to number 4.
Okay,
recently.
Well, that's good news.
Yep.
And do you attribute that to education, you think?
I think a lot of it has to do with education of the public, knowing that when they have stroke symptoms, to get to the hospital quicker. Treatments or acute treatments for stroke are done within the first few hours.
Okay.
If you have symptoms and you wait more than 8 to 10 hours, many times there's not a whole lot the hospital can particularly do for you to treat the acute stroke, and it's more salvaging what the stroke has actually caused.
Okay, okay. Well, as a registered nurse, I'm sure you've had, well, both of you, doctor and registered nurse, hands-on interaction with many individuals, different age ranges, coming in with different symptoms and other risk factors, but actually help us understand for our young people watching today as well as our adults, exactly what is a stroke? Doctor? I see the nurse looked over at you. You take this one.
A stroke is it's a very simple concept. It's an interruption of blood flow to the brain.
Okay.
Basic, simple. There are two types of strokes. The major type of stroke that we deal with is an ischemic stroke, or lack of blood flow to the brain through a blockage within a vessel.
Okay.
The other type of stroke, which covers probably 10% of the strokes, is a hemorrhagic stroke. That's where an actual blood vessel breaks and blood gets out into the brain matter itself. Ischemic stroke, or lack of blood flow, is the major type of stroke. That's the one that we tend to have the most interventions for.
Okay, all right. So with these various strokes, is it feasible that it can happen to anyone at any age?
Yes, stroke occurs throughout your lifespan.
Okay.
It typically reaches its peak after the age of 40. Risk factors start to accumulate throughout one's life, whether it's age, hereditary, gender. Those are things that we can't change in stroke. And then the things that we do change, hypertension, high blood pressure, #1 cause of stroke in this country. #2, diabetes. #3, probably smoking. 4, lack of exercise. Obesity.
Have an apple.
So those risk factors we can do something about. We can't, as a medical community or as physicians, nurses, we can't eliminate everybody's stroke risk.
Okay.
We can reduce or help patients manage it. Stroke is the #1 cause of disability in this country. If you're going to have a stroke, the vast majority of patients actually survive the stroke. And then you're left with dealing with the weakness on one side, or the inability to talk, the difficulty seeing, and all that. And that becomes a large burden on one's life and on their finances and their family and everything involved. So a little bit of prevention probably goes a long way in this case.
And I'd say to a great degree, a lot of education goes a long way in terms of understanding what can be done to prevent heart disease and stroke, but also, you know, even if you are not in one of those risk factor categories, how to recognize someone who might be actually enduring or encountering a stroke. Each year, the American Heart Association, in conjunction with the Centers for Disease Control and Prevention, the National Institutes of Health, and other governmental agencies, brings together the most up-to-date statistics on heart disease, stroke, and other vascular diseases and their risk factors, and presents them in a heart disease and stroke statistical update. And what I found was very interesting, several little bullet points that I want to mention. One of them, although, as you said, significant progress has been made over the past 4 decades or 40 years. In 2002, among Americans greater than 18 years of age, 20.5% of men and 15.9% of women continue to be cigarette smokers. And I know that you said, Doctor, that was one of the risk factors, but you know, as a registered nurse, and you're seeing this even continue, you know, is it really almost like saying, hey, you know, any moment now, you know, put me in for a stroke? It's almost like, I don't want to say suicide, but how do you get the message across to people that, hey, this is serious, this is really serious business here?
Well, one thing we do as nurses is educate, educate, educate. You know, we tell them it's not just a risk factor for stroke, it's a risk factor for lots of diseases. I mean, you clamp down your vessels every time you light up a cigarette. And, you know, we just tell them the importance of stopping smoking and just constantly reiterate and re-educate. And that's basically, you know, a lot of what nursing is, you know, we do deal with them when they come in and they do have complications of smoking, but the main thing is us being that advocate for that patient and just reiterating that, yes, indeed, you need to stop smoking.
Right. Now, I think that, because I have some people that I've known for a long time, family members, friends, who have been smoking, and some of them knew the risk factors or knew the consequences, I should say, possible consequences of smoking going into it. But it seems as if that stronghold is really more, you know, it really is, I don't even know if addictive is a strong enough word for it. What is available for those who are, you know, addicted to smoking to really help them to let that go? Doc?
Well, there's a number of medications that have been used to try to help people quit smoking. The one thing I see a lot with patients is that I think sometimes it's a matter of mind.
Yeah.
The best success stories I hear are people that I laid down the cigarettes and I never picked them up again.
It's tough.
It is. It's tough for people to change a behavior. And
not just that, but
and unless it hits them personally, it's hard to really change that behavior.
Yeah.
Dropping cigarette smoking not only carries decreased risk of stroke, but cancer, #1 cause.
Right.
Cancer, other COPD, you know, if patients were exposed to those kind of things a little bit more on a personal level, I think they would start to recognize a little bit more.
I think you're right, and I think that's why that clip we showed, the public service announcement with the NBA player talking about his mother. You know, I think the way he led into it was, you know, some event that changed his life forever, and it made you think that he was going to talk about himself, but he referenced his mother having a stroke. And I think that, you know, that particular public service announcements and more like those are very, very effective because, like you said, I believe not just with smoking, but with most things, it seems that it takes a crisis for us to really wake up, you know, and quite frankly, you don't always get a second chance. So what kinds of risk factors, I want to hit that a little bit harder again, because you've produced a slide on that to make sure that our viewers watching today understand that there are certain risk factors that can make you more prone to stroke.
Okay. Like we had said earlier, you need to make sure that if you have high blood pressure, control your diet if you can. If you're on blood pressure medicines, make sure that you actually take your blood pressure medicines. If you have the risk factor of, you know, having high cholesterol, taking your medication, changing your diet. Diet is a big thing. You know, we're in the South, we're in the stroke belt where strokes happen a lot higher than most other places in the United States. Making sure that you exercise at least 30 minutes a day. That doesn't mean, you know, you have to go out and run a marathon. Go take a walk with your, you know, with your family member, walk your dog, play in the yard with your children, you know, just those kinds of things. And like we reiterated, please make sure that you control that diet. And if you have what we call atrial fibrillation, that shaking of the heart that can produce those blood clots, please make sure you're on the medication that you need to be on to control that.
All right, Doctor?
What Rosalita brings up about atrial fibrillation atrial fibrillation is a condition of the heart where the atria, the chambers on top of the heart, don't contract in a synchronized manner, and they just kind of fibrillate. And so blood tends to become stagnant and can sit. And you can form clots when blood sits long enough, and eventually the heart will contract enough and it can push that clot out. The importance of atrial fibrillation is that patients are at significantly increased risk of ischemic stroke secondary to atrial fibrillation. So if you do have atrial fibrillation, being on a blood thinner is the typical treatment, and it's important. And it's important to have the checkup with your physician to see if you do have atrial fib. Many times patients will go in and out of atrial fib. When you check their pulse, the pulse is normal, and then at another time, under stress or something, they'll be in atrial fibrillation. So it's the going in and out of a normal heart rhythm that tends to cause the heart to contract harder and push those clots out.
Is that atrial fibrillation, I'm not saying that correctly, is that hereditary?
It's a condition, it can be hereditary. It's probably more lifestyle induced.
Okay. With
America becoming larger. The larger the animal, the larger the heart, the less exercise, the more floppy the heart. And when you have a heart that's not well exercised, it tends to be a little bit more floppy, and it tends to, the nerve signals going through it tend not to be as synchronized.
Okay, all right. So that then kind of underscores the point of the importance of exercise and just getting up and moving.
I think if we did more exercise, we'd see some significant changes. I think there's a lot of potential for us to make changes if we can get to the patients for prevention.
And that's what many doctors I've talked to and nurses say, that you know, that prevention is a whole lot better than actually treating, you know, a situation. You want to be in a preventative mode than you know, a reactive mode. And talking about the aerobic activity, in that same report, it says that 29.9% of adults reported engaging in no aerobic leisure time physical activity in our country. That is tragic. But I must say, honestly, that until the past year, I was in that number.
Yeah, I think that number's probably higher.
You think it's higher?
I think people tell you, they want to tell you what you want to hear sometimes.
You're probably right. You're probably right. And I think, you know, we have to just, each of us, self-examine our behaviors, our habits, and, you know, ask ourselves, you know, I know for me, and my husband and I had this very frank, very transparent conversation. Do I want to be here for you? Do you want to be here for me? Do we want to be around to see, you know, what God makes of our children and grandchildren? Now, of course, that's no guarantee. No man knows when it's going to be his last moment. But, you know, we should at least try to, with as much as we have control over our behaviors and activities, do what we can to, you know, have a good lifestyle. And health is certainly a big part of that. What does Aiken Regional do to help educate the community with topics like this, stroke awareness, heart disease, etc.?
As far as in the hospital, or as far as before they hit the hospital?
Both.
Okay.
Since you are the stroke coordinator, you're not coordinating strokes, you're coordinating prevention. There you go.
We are doing some community events. The Life Expo we recently did, and we will also be at the Aiken Electric Co-op annual meeting on May the 16th. We will be out there passing out stroke prevention, literature, trying to tell people, you know, let's control your risk factors. If you feel like you are having a stroke, you need to make sure, you know, what is that fast exam, recognizing those signs and symptoms of a stroke, the facial droop, the arm weakness, the slurred speech, and the most important is that time. If you feel like you are having a stroke, please don't lay down and try to sleep it off and see what's going to happen. time is brain. You need to make sure you call 911 and have them drive you. Please don't try to drive yourself to the emergency room, and get there as quickly as you possibly can, because if you get there within that window, there are treatments that we can give you that will either bust that clot or at least decrease the amount of disability that you will have from having a stroke.
And before we close out again, because we know some of you are rushing off to church, spot a stroke is fast. Face drooping, F. Arm weakness, A. S, speech difficulty, if you witness someone having speech difficulty, or if you're going through it yourself. And then T, time to call 911. We're going to elaborate on that and much, much more. Did you know if you're in a certain ethnic group, you might be at a higher risk for stroke? We'll tell you about that as well inside of Education Matters. We'll be right back.
The Will Gray Opportunity School has been serving the beautiful Midlands of South Carolina since 1921. Our mission has evolved over the years, and we now specialize in helping young people move past their obstacles in order to achieve success. We give students opportunities to lead, to develop social skills, to become active in their communities, and to taste success. Don't settle for less than the absolute best for your life. Contact us today to take the next step in your journey toward success.
Why go to college anywhere else? For the past 4 years, U.S. News & World Report has named University of South Carolina, Aiken the #1 top public comprehensive college in the South. You can attend one of the best universities in the nation with more than 49 majors in academic programs, nationally ranked athletics, and great student life. With small classes, the faculty and staff are focused on your success. USC Aiken, the university focused on you.
Margaret's Garden Adult Daycare is coming soon to serve the community of Aiken. We are dedicated to enhancing the emotional, mental, and physical well-being of our clients, allowing seniors to remain in the community as long as possible. A daily fitness plan, games, weekly outings, fine dining, and discussion groups are just a few of the services we offer to keep your loved one active and engaged. Margaret's Garden. We meet you where you are.
Weekends are for resting, relaxing, and recharging your batteries. A good weekend can also give you the time to catch up on business you couldn't get to during the week. For Security Federal Bank customers, that means banking business. What does 7-day banking mean to your banker? More importantly, what does it mean to you? At Security Federal Bank, being open 7 days a week means just that. That's why our Southside branch on Whiskey Road in front of Target is open for business every day, even Saturday and Sunday. We're proud to be the only bank to be open 7 days a week in Aiken County. If we were you, we'd bank with us.
I lead a busy life, but I still have to make sure my family eats right. And everybody loves Dawn's Seasoning Delight. I use Dawn's on meats and vegetables. It's healthy, tastes great, and it's simple to use. It's like having a chef in a bottle.
My seasoning is available at Kroger, Bi-Lo, Food Line, Roots and Harvest. Look for it on display in the meat department. Also visit seasoningdelight.com for information and recipes. Dawn's Seasoning Delight. It's so good.
If you are interested in becoming an individual or corporate sponsor of Education Matters, contact Donna Moore Wesby at 803-507-6793 or email at donnawesby@aol.com.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. You constantly ignore me. You barely eat anything healthy. You're half as active as you used to be. The pressure is just too much. I quit.
Okay, I get it. I'll do better. Just please, don't leave.
Okay. But remember, if I go, you go.
Listen to your heart. Don't let it quit on you. Uncontrolled high blood pressure could lead to stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Welcome back inside of the broadcast. May is National Stroke Awareness Month, and today inside of the broadcast we have representatives from Aiken Regional Medical Centers sharing with us details on how you can spot someone who might be in the midst of a stroke, or maybe if it's you and you are with someone who is going through it, what you need to do. And we're just hopefully enlightening you on, again, what is happening in our country with regard to strokes and obesity and hypertension, because all of those things are risk factors for those who may be prone to stroke. And while, you know, some of those public service announcements are so funny, in reality, it's a very serious topic, and I like what the Ad Council is doing to try to grab your attention. But joining us here in the studio as we talk about this very, very important topic is Dr. Gregory Sengstock, who is a neurologist with Aiken Regional Medical Centers, and a registered nurse here, Ms. Rosalita Kirkland. I got the names right. Very good. I am the world's worst with names. Thanks again for joining us. Now, in that last public service announcement, we saw an African-American man talking to us about, you know, talking to himself in a sense about stroke and the heart not leaving. But there is also a very stealthy message in that public service announcement utilizing an African-American. Tell us about that. An
African-American male.
Yes.
They're #1 for risk factors for stroke. By far.
By far. And that's
by far.
Over any.
For ischemic and for hemorrhagic.
And why is that, you believe?
Hypertension and diabetes are probably the biggest things. Genetics probably plays some role in African Americans having higher risk factors, but we know within that African Americans that they suffer more from hypertension and diabetes.
And I wonder if with both of those it could be related to our diet and you know, our chosen foods that some people just like to eat.
In the South.
Yeah, in the South. Exactly, exactly. And,
we won't name anybody.
There are certain foods, you know, in the South. We've got the fried chicken, we've got the barbecue pork, you know, we've got the breads and the pastas. Yes, definitely the desserts. You got to have your little something sweet, right? And then you pay for it later. And actually, going back to that same report that we referenced earlier from the American Heart Association, it says 33%, and I'm like you, it may be higher, of United States adults greater than 20 years of age have hypertension. That is over 1/3 of our adults. This represents roughly 78 million U.S. adults with hypertension. And the prevalence of hypertension is similar for men and women. However, as Dr. Sengstock just pointed out, African American adults have among the highest prevalence of hypertension. That's 44% in the world. So we've got, it almost seems as if we have to have a very direct message to African Americans about, you know, being overweight, obesity, managing or getting their diabetes and hypertension under control.
It is.
Because some of it is genetic, as you said, genetic disposition.
Yeah. That ad on the heart with the African American male was perfect.
Yeah, yeah.
You know, Caucasians tend to have the lowest risk factors. Hispanic folks tend to fall somewhere in between for most of them.
Okay. Well, throughout today's broadcast, we've been seeing the FAST, the F-A-S-T. Rosalita, I want you to expound on that for those who either what they should do if they feel as if they are experiencing a stroke, and then for those who may be with someone who could possibly be exhibiting some of those symptoms. Before you do, I want to show another public service announcement that is again emphasizing FAST, F-A-S-T, and we'll have our resident registered nurse expound on it. Take a look.
So they say it's a man's world? Well, I don't see anybody's name on it. While they were out doing their thing, we slowly changed all that. We changed all that. Today, women can do anything men can do. And there's one thing we're even better at.
Wow, you're talking about making an impact, and of course there that was speaking specifically about hypertension and a message there in hypertension in African American females. But we want to make sure that we are ready in case something did happen. Nurse?
So like we said, we need to reiterate FAST. If you are with somebody and they start having facial drooping, either on one side of their face or both, or numbness, sudden headache that they can't explain, if their arm feels tingly, or if they have weakness on one side, if they start slurring their speech, the FAS and then the T is time. Time is brain. You need to make sure you get to the closest emergency room. If you are by yourself and you feel like you are having a stroke, as I said before, please don't try to drive yourself. Call 911, tell them exactly what's going on, when the symptoms started, and making sure that what happens is the EMS has certain protocols, and when they feel that a stroke is going on, they know exactly what to do, and they will get you to the nearest emergency room that is capable of taking care of you. This is not just for adults. If you have little children at home, if you need to reiterate to them too what FAST is. If their grandparents or their parents or even their siblings are having these signs and symptoms, please teach them that they need to call 911 immediately.
And I see in the symptoms of a brain attack, and I want to, you covered a couple of those, but even sudden confusion, trouble speaking or understanding. A new one to me, trouble seeing in one or both eyes, dizziness, severe headache. What's actually happening that causes those types of effects?
Well, the brain is a very complex organ, and it has very specialized areas within that. Blood flow travels to the brain and it spreads out like branches on a tree. So if you affect one branch, you may affect a specific area of the brain that deals particularly with speech, comprehension of speech, something to do with vision. Your visual cortex is usually in the back of the brain, and it covers a fairly large portion of the back portion of the brain itself. And if you had a clot that developed back there, you would lose vision to either one side or the other. If you had a clot that came up a vessel and went to the back of the eye, you'd lose vision in just one eye. So what it is stroke isn't just one thing. It presents multifaceted, many different appearances of it, and sometimes it's difficult to recognize. But the way I usually comprehend it is it's usually maximal onset at the beginning, or maximum deficit at the beginning. It's not something that starts small and tends to progress and get bigger. It tends to be bad right at the beginning.
Okay.
Okay. And so,
and that's why you have to do something about it right then.
Yeah. Stroke usually will affect one side of the body versus the other. The left side of your brain controls the right side of your body. The right side of your brain controls the left side. So usually if you're going to have a major stroke on one side of the brain, you're going to have a facial droop on the opposite side, an arm weakness, and a leg weakness, inability to walk.
Okay, all right.
So.
Okay, and Ms. Kirkland, I've heard you refer to time is brain. Time is brain. Explain what that means.
Well, when you start having a stroke, you'll start having permanent disability of your brain. Your brain is filled with millions and millions of neurons. You kill 32,000 neurons a second when you're having a stroke, and your brain ages 8.7 years for every second that time passes. And we have time parameters anywhere from 3 to 4.5 hours from time of symptom onset that we can give you medication to bust that clot.
Okay.
So that's why we tell you when you start having those symptoms, you need to get to the hospital immediately.
All right, so if someone is having a stroke and they simply cannot get to a hospital within that time frame, are there any is there anything that can be done in the home to help them? You know, I've heard it said before, people feel as if they're about to have a heart attack, they would take an aspirin. Okay, I don't know if that's true or not. We're just a little
to this
wise
day, an aspirin still remains the one treatment that is truly effective.
Okay.
So if you are thinking you're having a stroke, an aspirin is probably appropriate.
Okay. All right. Okay. So that's really the best.
Right.
The best advice I can be given.
Rosalita talked about some time frames, and for years, actually for decades now, we're trying to push that time frame back farther than that 4.5 hours or that. And just recently, there's been treatments that have become available to perhaps extend that treatment out for a subpopulation of people who present with a stroke. So if you present with a particular type of stroke and we can't treat you, we can still perhaps have an intervention that can help minimize the deficit out to about 8 hours or so now.
Okay, all right. Now, you also mentioned that stroke is the #1 cause for disability in those who have stroke. Now, is it a permanent disability usually?
I'd say that if it's a major stroke, they probably will be left with some disability. From the time you reach the hospital, I mean, that's from my experience, strokes tend to start to improve.
Okay.
Okay, so patients will recover within the first 3 months is their biggest time of recovery. The next 6 months is a little bit less, but patients can still recover even out to a couple years after a stroke.
Okay.
We know that a lot of patients with major stroke get sent to rehab centers, and the rehab centers help patients deal with the deficits because they have to have a new lifestyle. It doesn't necessarily expedite the healing process. The healing process takes place by the patient's motivation and their continued use.
Okay.
And there's a relearning process for a lot of patients with stroke.
Another reason I wanted to have this broadcast is, you know, although we're talking about stroke, it is, in today's times, it is affecting more than just senior citizens, as it seemed to be when I was growing up, that was just a disease that affected those who were categorized as being a senior citizen. But certainly in the past 5 years, it seems, I see more people my age, which I'm 45, having strokes and younger than ever before. So we really have to take this seriously. And there's also a message, Ms. Rosalita, for our young people as well. And I saw a statistic in 2011, 18.1% of students in grades 9 through 12 reported current cigarette use. Our young people, I'm sure, don't understand what this could possibly do to the rest of their lives. Share with us, you know, a message that we need to send to our young people, because their parents don't know probably that they're smoking, but those kids who are watching today, you know.
Yeah, every day in my practice, I see young patients who come in and they smoke, and I've seen the devastation that cigarette smoking brings. I try to convince them or to tell them that they're early in their path. They can change. They can change that behavior. They don't necessarily need to go down there. I think what drives a lot of that is peer pressure, and I don't know if it's looking cool or whatever that is.
Oh, come on now. You remember how important it was. You're not that old. You know, fitting in
as a father,
and being cool.
I never had to deal with cigarette smoking. I was lucky that way. My
but
kids,
being cool and fitting in,
yeah,
that's just it.
And so every day I try to stress to the young people that there's multiple effects from smoking cigarettes. If they had to, you know, actually look at a lung after 50 years worth of smoking, they'd probably say, oh my, you know, no way am I going to start down this road.
Right.
Or if they, you know, had to deal with the lung cancer, if, you know, the problem with cigarette smoking is that the effects are usually somewhere down the road. It's not readily apparent. If you know, if you're driving down the road and you see another car coming at you, that's an immediate danger, and you're going to avoid that.
Yeah.
With cigarette smoking, the danger is usually down the road. But now we know what those dangers are, and we just really need to stress to them that they're early on, behaviors can change.
Definitely, and it starts today. If you are watching this broadcast and you've heard information maybe you've heard before, well, we hope and pray that you will receive this information to help make a positive change in your life or in the life of someone you know or love. If you gotta go, here's some contact information for you for Dr. What's your last name?
Sengstock.
Sengstock.
We'll get to your
It just left me just like that. Aiken Neuroscience Center, you might have to evaluate me. 803-226-0130. We'll be right back.
What's up, God's people? It's me, Charity, with this week's segment of Charity's Corner, because I've got something to say and I can't hold it in. You know, parents can say some of the most confusing things to us kids. My mom and I were talking about how our neighbors, Mr. Joe and Miss Ann, are getting a divorce, and my mama says to me, well, Mr. Joe thought the grass was greener on the other side. What in the world does grass have to do with it? My name is Charity, and it's all in the name of love.
Oh, Charity. What in the world does grass have to do with it, Dr. Gregory?
I'm not certain.
Well, anyway, thanks so much for watching. You are inside of Education Matters. That is little Charity, because you know we do love the kids. Special shouts out to, again, Mr. Caleb Lee Master for conceptualizing little Charity, and also our very own here, Mr. John Gray, for bringing Charity back to life, who visits us from time to time with her little thoughts. I tell you, I don't know where she gets these things from. But closing us out today are our guests, Dr. Gregory, we'll leave it at that, and nurse Miss Rosalita from Aiken Regional Medical Centers. We've been talking about stroke awareness details today. For more information, please contact Aiken Neuroscience Center, and they're located at 100 Aurora Place, Suite 300. The phone number 803-226-0130. And of course, you can also go to the aikenregional.com website for additional details. But you also have some facts you wanted to share, Ms. Rosalita, regarding how Aiken Regional can respond.
Yes, Aiken Regional, the care that we give at Aiken Regional, we have our emergency room physicians and nurses are specially trained in the care of the stroke patient, and we have 3 floors inside of our hospital that can take care of stroke patients. So when a patient comes in through the emergency room and is having signs and symptoms of a stroke, we activate what's called a stroke alert. And if Dr. Sengstock is on, he comes and evaluates the patient and determines whether or not we need to give medication to help decrease that clot. And if he is not available, we do have what's called teleneurology. It is our REACH program, and it was dubbed REACH, and what it stands for is remote evaluation of an ischemic stroke. And so we have coverage 24 hours a day, 7 days a week.
Very good. And again, if our viewers, if they happen to be with someone who is exhibiting some of the signs and symptoms, what should be their very first steps?
First thing, remember, fast. If they're exhibiting signs and symptoms of stroke, pick up a telephone and call 911. Like we said before, do not try to drive yourself. You need to get to the emergency room as soon as you see and realize that you're having these symptoms.
Doctor, any last words for our viewers today?
Control the blood pressure.
Yes.
Watch the diabetes. Quit smoking.
Yes. Simply
and get
put.
some exercise.
Yes. We gotta move. We gotta move.
You moved last weekend.
Yes. I did. And that's our message. We gotta get up and do something, and you gotta start somewhere.
Right.
How much time I got left, John? All right. You gotta start somewhere, and you know, if you are watching and you're sitting on the couch, and after this broadcast is over, don't just go to sleep. All right, get up for 15 minutes or so, move around, walk around the neighborhood, take the dog or the cat out, do something. And then gradually you'll be able to increase. And that's actually what happened with me to enable me to just be able to complete the 5K. As my husband and I finally quit talking about it, and we became bout it, as the young people say. And we started, and each week, actually, we built up endurance, and we were able to keep going. So thanks again for coming on today. I know you have got to go save some lives, and I believe today inside of this broadcast, it will do just that. Thanks so much for watching Education Matters. Remember, FAST, F-A-S-T, the signs and symptoms of a stroke, okay? It starts with education, because learning is living. My name is Donna Moore Wesby. You be blessed.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment, and that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.